question today that she will address is what strategies will help decrease poverty in our community and create economic stability for young families. In December of 2014, the United Way of Dane County launched the Madison Community's Delegation to Create Economic Stability for Young Families. The 40-member delegation representing local and nationally recognized poverty-reducing and equity-building stakeholders met regularly over the next year to study and better understand poverty in Dane County, evaluate successful solutions, and build a plan to mobilize the community around the most effective local strategies to help young families become self-sufficient. As we know, Renee became president and CEO of United Way of Dane County on January 1st of this year. Prior to this position, she served as the Executive Vice President of Resource Development and Marketing and has been the lead officer of the organization since 2004. She holds a JBA and an MBA degree from UW-Madison, is a 2015 YWCA Woman of Distinction, and also a member of several local organizations, including Mortgage Center Board of Visitors and the Wisconsin Women of Color Network. She's been a member of the Rotary Club since 2005 and served as our president in 13 and 14. In addition to her relationship building and fundraising development skills, Renee partnered with Madison Metropolitan School District to develop training for United Way's trademark Schools of Hope tutoring program and staffed the Born Learning Delegation, which aims to ensure more young children are prepared for kindergarten by 2020. Renee lives in Madison with her husband, Jason Salas, and their 2 children, Nick and Nora. Renee?
Strong roots. What do you think about when I say strong roots? What are some ideas? Corn. Yeah, okay. What else? Trees. And what about trees? What's that? Stability, right? Firm foundations. Strength. Families. To be able to weather tough storms, branches reaching toward the sun, right? Opportunity. When you think about strong roots, that's stability. When I think about strong roots and what I want for my children and our community's children, we want them to have strong roots, right? A strong foundation. We want them to be able to have roots that dig into nutrient-rich soil to be able to grow and sprout and have a stronger community. But sadly, there are a number of individuals in our community who don't have those strong roots, in particular our community's children. Many of us revel in this beautiful, wonderful community that we love so much, and we know the quality of life here is so good, and yet we're wondering about the reports that we're hearing about, right? Shootings at the mall, robberies in our neighborhoods, and we hear about the racial disparities, and we think about all of the data and the conversations we're having around the community. We're wondering what's happening to Madison, what's happening to this community that we love so much, and we're wondering how do we maintain that quality of life that so many of us love and appreciate, and how do we extend that opportunity to others in our community who want access to that opportunity as well. And so that's what we're here to talk about today, what the board and I feel is most important as the organization goes forward, and the most important issue our community is facing, which is growing poverty, particularly amongst our community's children, and how that poverty shifts the soil under our community's feet, and really how we have the opportunity now to embrace and wrap our arms around those families to make sure that our community continues to stay strong and is even stronger for those who need that support. Oh, I have the clicker, correct? Okay. Aha, should have started with that. I'm glad that start was strong at least, right? So here we are in terms of a little grounding. You all know that United Way exists by the community and for the community, right? You know there's a busy marketplace in terms of social services. There's discord about what is needed. There are lots of players. Resources are fragmented. And we need to have community-level metrics. Oftentimes it's very hard to figure out how do we look at community-level metrics to figure out how do we create change. And this is how we work on community issues. We tried to untangle complexity, focus around critical needs, look at research-based best practices, align resources around community-wide vision, and then deliver results. That's really what you expect from us as an organization, so that's what we're doing. Last year you heard my predecessor, Leslie Ann Howard, come in, and she gave you great reports on a lot of initiatives that are seeing excellent results, early childhood, education, employment, housing. And what we're seeing is, with all the changes in our economics, in technology and demographics, we have the opportunity to really align those great learnings and great resources to be able to affect longer-term systemic changes. And that's why the board asked to convene this delegation last year, led, as Ellsworth pointed out, by Chancellor Becky Blank, who is a nationally renowned economist, has published a lot on poverty, and who is also has run the census, so knows a lot about demographics and trends and shifts. Also co-chairing that was Chief Noble Ray, and he, of course, had the community-level credibility to be able to bring all that understanding from being police chief to able to move that forward. And with those 40 members, they met for a year to look at the individual issues. So how do you untangle? First, digging into the data, listening to the community, and understanding what are the needs and issues. Then researching best practices and figuring out who are all the stakeholders playing in this space. What are the current programs? What are the current opportunities? And where are the resources coming from in terms of being able to address and reduce these issues? Then designing a community-wide goal and recommendations to transform the community and to create even more change. Figuring out how do we transform service delivery, and ultimately stabilizing outcomes for communities' most vulnerable families and individuals and children. So once the learnings and recommendations are put to paper, then staff and volunteers go out and they meet with lots of different stakeholder groups to make sure that things are resonating. We get that community-wide goal and scale. And just a few weeks ago, we announced the final recommendations at Monona Terrace. And thank you for many of you for being there. I know a lot of you saw the extensive coverage because of the wonderful texts and emails and conversations we've been having. So it's really wonderful to have your support on that. So now the real work begins. How do we continue to align those resources and drive that change forward? So I want to share the learnings today, and I want to share the recommendations today, and then have a conversation about what all of us can do to be able to help address this most critical issue in our community. If you look at poverty trends, they're consistent from Dane County and our local statistics across Wisconsin and the United States. So if you look at 16% nationally of people in poverty and 14% here locally, do you all know what does poverty mean in terms of federal guidelines? For a family of 4, how much is the annual income? A little less, $24,000, okay? $24,000 for a family of 4. Extreme poverty is $11,000 for a family of 4. Think about that, and think about what that means in terms of managing your budget. We also see poverty in Dane County continuing to increase in the slow economic recovery. So 66,000 people in Dane County currently in poverty, and 16,000 of them are children. So think about that. In Madison alone, there are 44,000. That's half of Camp Randall Stadium. If you think about poverty across Dane County, that's 80% of Camp Randall. So put that in perspective. So 1 in 4 Madison babies are living in poverty, 25%. So this is a huge issue for us to be addressing in terms of the future stability of the community. Poverty and race are also deeply intertwined. If you look at African Americans, they're 3 times more likely to be poor than whites. Latinos and Asians, 2.5 times more likely to be poor than whites. While the numbers of white children and African American children in poverty are the same, the disparity is such that the wider number of population is in poverty. So I just want to emphasize that because race and poverty are different things, right? Poverty is about income. Race is about how we treat each other. And when we look at both of those factors, we have to address them both as we tackle and address these issues. Single-parent households are most likely to be in poverty. And that makes sense, right? You have 1 income versus 2 incomes. There's also much more stress and instability in those families as well. So poverty by family structure shows striking differences, and that's why we choose to address poverty in young families. You look at single-parent, female-headed households are most likely to be in poverty. And in these strategies, we include fathers, because even if they aren't custodial or in residence, they're still a part of the picture. So when you hear us talking about families, that does include fathers. We want to make sure strategies are embracing the family as a whole. Here's a map of Dane County. I think one of the biggest ahas around this map is take a look at where you spend your days, where you drive, where you work, where you come and have Rotary meetings. It's very easy to not understand the breadth and depth of poverty in our community because it's so easy to move around our days and lives without walking into these yellow or orange or red areas. Families living in these pockets of poverty are at a disadvantage and very isolated. And here's the thing. They all want the same things that you and I want. They all want stability for their families. They all want their children to grow up happy and healthy. And they all want to be able to have the opportunities to get stable and to do the best for their families, every single one of them. And I think sometimes we really are wondering why root causes of poverty and how people got into that circumstance, and we think about people getting employment or making bad decisions. And really, I think if we can start from the place that everybody wants the same thing, which is stability and healthy outcomes for our families and children, I think we can get a lot farther together. So What's driving these high poverty rates among single-parent families, and in particularly among single parents, single families of color, single parents, families in color, and why does it matter so much? Housing is expensive, right? Let's talk first about those economic issues. How much is the average one-bedroom apartment in Madison, do you know? About $700, a little over, $766 a month. So to afford the average one-bedroom apartment, you need to make about $30,640 a year, right? So 30% of income tends to be the benchmark. The cost of rent has outpaced our workers' salaries in Dane County. So this is a huge destabilizing factor for these families. Over 21,000 families are paying more than 30% of their income on rent, squeezing the rest of the budget on essentials such as food, childcare, clothing, and transportation. Makes sense, right? If you look at a two-bedroom apartment, just for reference, it's about $928 right now in terms of market value. Also, we're seeing unemployment as a major contributing factor. So again here, if you're looking at experiencing unemployment, African Americans 4 times more unemployed than whites in Dane County. And some of this reflects skill differences, but the employment difference is larger than skill differences would suggest. The nature of unemployment also matters as well. So not only are folks unemployed and looking for work, but you also have a lot of companies and a lot of individuals who are paying incomes that are lower, but you have scheduling too. As we've gotten smarter about inventory management and personnel management, you now have hourly workers who are maybe scheduled for the morning drive and the afternoon busy seasons in drive-through restaurants or other service organizations and restaurants and hotels and things like that. And so you don't have the ability to put together a schedule that allows you to focus on sustainable and stable childcare, or to put together, your income in a way that's more holistic in terms of helping to support your family. So irregular schedules and growing use of flexible scheduling in some sectors of the economy has made life worse for single-parent families. And we know the effects on children are particularly poor. We've talked a lot here at Rotary about the first 1,000 days of life and how important that is to help children get on pathways to be successful in school and life. And new research on brain development indicates the difficulty of children to realize their full potential before the age of 3 if they live in poverty. So we know that physicians on our delegation, and many of the folks in the room who are on the delegation heard them say this, they can see disparities and they can see gaps as early as 6 months. And this chart is showing typical environments and high-risk environments. By the time a child gets to kindergarten, they may be as many as 2 years behind. So think about that in terms of our opportunity to help wrap our arms around those babies. There are significant issues and measures on executive function, working memory, certainly vocabulary, which you know a lot about, visual attention, language, all of these things which create a lot of difficulties for young people as they're starting school. And poverty also poses a serious threat because they're less capable of adaptive skills and coping skills. So what does that mean? We all know that a certain level of stress is important, right? You build resiliency, toughness, you're able to get back on your feet again. So when you have positive stress or tolerable stress, you have issues in a child's life or a person's life which are, you can move on from that. The tolerable stress are those where you have a stressful circumstance, but some nurturing, some love can bathe that cortisol brain in dopamine and get people back on track again. When you're looking at toxic stress, this is prolonged stress, and toxic stress is experienced much more frequently by children in poverty and is the main culprit in lags in learning. It can be triggered by parental stress, right? Housing relocation, worries about paying for food and rent. Oftentimes that tension creates a lot of stress between relationships. Also lack of neighborhood safety. All the problems that poor families cope with on a daily basis. So to break through these problems, we need to address the success of the whole family. The delegation's conclusions are based on the current research, which suggests the best opportunity to create change, especially in a child's brain, is before the age of 3. Prolonged exposure to poverty increases the likelihood that children will grow up poor and will have a harder time breaking out of poverty. But children's brains also develop through relationships with parents and their caregivers. And many of the stressors that children face are because of the stresses their parents are facing. So we have to support both parents and children. And that means working with the whole family. So here's the least visually appealing slide, but the recommended strategies by the delegation. So first, ensuring children in poverty are developmentally ready to be successful in school. And there are wonderful programs and great approaches. And we know that home visitation, for example, helps children who are in poverty graduate at the same rate as those of middle and higher income children. So there are lots of evidence-based practices that are currently working in Dane County. Also, securing family-sustaining employment for young families living in poverty. So when you have employers who need workers and you have people who need jobs, how are we working with the nonprofit community and employers to really map that supply and demand to make sure that we have employees ready to go, ready to be employed, and are on pathways to have more income to be able to sustain themselves and their families? We also want to increase the amount of affordable and accessible affordable housing in Dane County. The inventory shortage is a huge problem. And so how do we work together with landlords, with developers, and with others to make sure there is more housing for people to go? Because we know when people are in housing and when they're stable, they're more likely to build more pathways onto success and to be more stable. And then, of course, holistic two-generation coordinated supports to young parents living in poverty. And so we explained a lot about that in terms of the child stress and the parent stress. Now, you may be wondering, why did it take you a year to come up with these things that seem pretty intuitive, right? And again, there are a lot of great things that are going on already, and putting these together with a new lens is, we think, the opportunity to create even more effective change. And here's why. The Dane County systems are currently not set up in this way. We've had wonderful results, as I mentioned, in all of those individual sectors. So early childhood providers coming together, employment providers coming together with nonprofits, housing, and others. But there are still many social service silos. We want to create a system of holistic and accountable supports that puts the family in the middle and helps us not only have great results in individual programs and collaboratives, but more holistically has change across the community. So it's not easy. It requires experimentation and effort of all the groups involved to figure out what works. Also conversation across those silos, right? And one of the major roles of United Way is convening and facilitating all the different groups in their different silos to come together to figure out how do we get more done together than any one of us can alone. It requires at least some people who can work with families and connect them across multiple services, and also cultural competency to engage with families over a period of time. So this requires a high level of leadership, and this is why I love coming here to this group, because we believe in service above self, right? So all of the work and all the activity that we need to do, we have to look at the greater good and what needs to happen holistically in the community, even amongst our individual needs and our individual desires to create change. How do we collaborate and partner together? Because that's what creates the disruption in the system and the more effective delivery of service to help create the change that we need. So this is bigger than one organization, right? This is bigger than United Way. This is about accomplishing more together than we can alone, and that's what the big call to action is today. So we can get this done. We need a larger collective impact. How do we invite all who wish to work in this space to come together and figure out how do we align those resources to connect change? To the business community, outreach to hire non-traditional individuals who are in poverty and in color, people of color, to be able to have that employment. To the nonprofits, continue to innovate, to build capacity, work more collaboratively across the community. To faith communities, right, extraordinarily important. Huge numbers of people who are wanting to care and give back and do more. How do we engage faith communities to mentor and volunteer and to help? And then, of course, to elected leaders, evaluating laws and rules to figure out what provides inappropriate consequences, what keeps people and their children in poverty. And Marv Levy encouraged me to get together with employers and government to talk about how do we even recruit more businesses into the community who have more of these jobs that could help people on pathways. So our employer council is really grappling with those issues, and we look forward to expanding that as well. So if you look about, you think about what's the main point today, and I want to leave plenty of time for Q&A. We know for sure reducing poverty in our community increases the health, education, and prosperity of the entire community. So we can and must take a local approach. It takes each and every one of us, and as I look out across the room, there are literally dozens of you on our board, partner agencies, donors, volunteers, partners at nonprofits and other community groups, law enforcement, healthcare. We've got to do this together, and that's really what we're working on here, is how do we more collectively create this change. And United Way is committed to hold folks accountable and hold ourselves accountable, and you can hold us accountable to make sure that we are driving progress and that we are seeing these systems come together even more effectively to drive change over time. So with that, that's all about strong roots, right? We've got needs in our community, we have opportunity, and here's the scope and scale of the issue. So please help us build more strong roots, and I look forward to your questions. Hi, Marv.
Renee, thanks for acknowledging my presence. Looking at your key participants in your goal achievement, I noticed you missed a big segment of the Madison and Dane County economy.
Okay.
The government.
Yes.
Government agencies, government employees, who are frequently nearly all white, dominated by government employee unions that are interested in seniority, and totally or nearly totally uninterested in new job entrants. So I'm wondering why that piece is missing for the puzzle, because these same politicians criticize the private sector for not coming up with enough answers or solutions.
Certainly. So within elected leaders as well as governmental organizations and agencies, there's been a lot of dialogue and a lot of conversation about looking at employee-based groups and looking at recruiting differently. So for example, I know the city had an initiative not too long ago talking about making the hiring process more equitable, looking at how we're recruiting people from communities of color. So I feel like the government is embedded in the recommendations, and rest assured that there's a lot of conversation going on about the public sector jobs and how to diversify those jobs as well. Herman. Oh, sorry. Who's got? Okay, great. Hi, Tanya.
Hi, my name is Tanya Ibarra, and I'm a guest. So I do have a question in this strategy because I've been thinking a lot about these issues lately. And one of the things that I continuously see missing in the strategies that we put forward is the resource allocation issue. So I find it, the resource allocation gets decided at the top level, leadership level, boards, not just public boards, but private boards, nonprofit boards, all of those boards, CEO, the C-suite. And that's where the resource allocation issue really lies. And sometimes with the strategies that I see that are more grassroots oriented, which I feel sort of these call to action is, it misses that part, and it feels like an uphill battle in terms of we're trying to address the symptom, which is people who are in poverty, and I also struggle with the concept that the people in poverty are the issue, where in reality is the resource allocation that creates these people who are in poverty and don't have jobs and all of those things. So my question is, what is the initiative to really address that leadership gap in terms, across the board, in all the entities? Because I'm the president of the Latino Professional Association, so I keep getting requests like, we need more workers, we need that. And there are times where I'm like, okay, here's the resume, and I know this person is qualified for the job. I know they can get the job, but then they don't get the interview. And so I'm struggling with a call to action that doesn't have that addressed, because I think that's what we've been battling for so long.
No, thank you. So a couple of things in the question. So first, when we talk about families in poverty, there's certainly never any intention to blame the people in poverty. And I think when you look at everyone, we have assets, right? And so you look at many of the individual families that we're talking about have great problem-solving skills and resiliency and cultural competency in terms of what we need in our organization. So please rest assured that from the perspective of how do we build on those community assets is a huge priority of United Way and those in our partners. So thank you for bringing up that point. It's a really important one for me to also underscore. Regarding resources, I mean, that's always the million-dollar question, right? Is who gets resources and in what order? And I think as we're thinking about, how do you take the many resources in our community and deploy them most effectively to create changes, that is the big challenge, and that's why we have to work collectively to figure out where that is. When you look at the leadership gap specifically, there are a lot of ways to think about this, first of all. Within communities of color, there are a number of initiatives working on building leaders within communities of color and people in poverty who perhaps already have leadership that isn't recognized in our more traditional systems. So programs like Boardwalk, for example, how do we place more people of color, more people in poverty on boards in decision-making roles to make sure that all voices are heard and from a grassroots perspective up. Also more investments in local community groups and grassroots organizations who are working toward building out their own capacities and building more results and outcomes to help move that way forward too. And more directly to answer your question, specifically about leadership and resourcing, I think there are a lot of really wonderful initiatives going on right now across the community, looking at helping to elevate awareness of biases inside of hiring systems, bias inside of who gets the resume forward, how do we help work together. And can I tell the task example with the YW? So the Hire initiative that I mentioned earlier is really talking about, again, mapping up individuals who want work, who need to work, along with employers who have jobs. And Task, who's a great United Way supporter, was looking at doing more with customer service, partnering with the YWCA. And there was a whole cohort of employees who went through training and then who were placed at Task in their call center. And what was so interesting about the chart, so from the folks they hired in their what I would call their regular traditional pool from HR, took them about a week to get up to speed in terms of performance expectations, and then they were performing as expected. The folks that came out of the YWCA cohort took about 4 or 5 weeks, but then they were performing just as well. So it took a little bit longer with a little bit more coaching, but they perform just as well, and the retention is significantly higher. So I think from the perspective of building these unique collaborations where people have more awareness of what are the biases inside of hiring, how do we partner more in communities to make sure that we have the right pool of individuals to get into our workplaces, and then how do we measure that success over time? I think that's a really successful place to start and a place that all of us can learn from in terms of growing diverse populations and to help more people on pathways out of poverty. So is that helpful? Is that a satisfying answer, or is there more to be said there? So the strategy is to change boards specifically? So to change boardrooms in companies or in funding organizations? Mm-hmm. Yeah. So I think, again, I think that the raising of awareness, and I think the raising of intersection of people connecting with other parts of the community, so from my vantage point, in terms of looking at boards, looking at funders, looking at other organizations, and looking at who's making decisions about where funding is going, I feel like there is evidence that there is change and heightened awareness, but there's still more work to be done. So if there's a follow-up question, I'd be happy to answer. Karen?
Hi, thanks for sharing your plan with us today, Renee. Mm-hmm. Before I came to Madison, I lived in Detroit for 30 years, and one of the issues I tackled there, along with my husband Larry, transportation, connectivity, mm-hmm. and access. And I didn't see anything about that on your slides, but then I was too short to read some of the captions. Mm-hmm. Owning a car costs $6,000 or $7,000 a year. And that's often the price of access. That's more than half the income mm-hmm. of a family in extreme poverty. And Madison, I don't think, does much better job than most other communities of having the people who want to do the work in close proximity to the work they can get to. Mm-hmm. Downtown to Middleton is an hour-and-a-half bus ride if you're trying to get there at the wrong time of day. Have to go along the way and drop your kids off at daycare is another hour. Mm-hmm. Just one direction. One of the stressors in these families is hours a day waiting for the bus, worrying that it won't come, finding it's late, managing your children on the bus. Who of us here would volunteer to give up 4 to 5 hours a day just to get from where you live to where you work, or where you live to get your kids to childcare? There's no time left for anything else. And I think that one slide where you had all the silos of services mm-hmm. and mm-hmm. needs, I think the hub ought to be transportation.
Here. Transportation is yeah. Mm-hmm. Yeah. Well, the YW certainly has a great program in terms of the transportation. So the van services that help people get from here to there. And you're right. I mean, you look at this this map here in terms of where people are at. How do you get to the places with higher amounts of population of jobs, and to have the transportation you need? So again, I think there's a lot of conversation going on there. You're absolutely right. If you've got an elementary schooler who starts at 7:30 and a middle schooler who starts at 8:30, it's very difficult to get there, then get to work, get them home, childcare, and other things. So, it's a very valid point. Yes, Herman, and then go ahead.
Oh, Renee, we as a club give a lot of money to community organizations. Could our philanthropy be more effective if we were to align what we do around the objectives that you've presented?
I think that's a question for the membership to address. I mean, I think the opportunity is, if you look at what does the community need, and how do you, it's not only about money, right? You want it to leverage the funding, the community will, the volunteerism. So, yes, I do think that if there were more coordinated effort across the whole of the community to address these high leverage strategies, we could have greater outcomes. But I think that's for the membership, and those are for the committees and the board, to Tanya's point, to decide, and to have enough information to know how to make great decisions about where dollars go is important.
Renee?
Dick Goldberg, see you later. Thank you for your support as well. Yes, Ron.
Renee, could you go to the slide that was with the bubbles?
Sure. So glad I have this clicker.
So for those of us who'd like to give of our time, our thought, and our money, what I wonder about here in terms of connectivity is being able to see how you'd map those needs to community organizations that may already be funded by United Way, that may be organizations that this organization will wish to fund. But what I see missing here is the connectivity in terms of organizations that may already exist, and how could we apply improvements, new resources, and such to affect the outcomes and the objectives you're seeking?
No, that's a great question. And so inside each of the bubbles, of course, are huge networks of organizations, so public sector, nonprofit, and private sector, too, who are investing greatly. Steve Goldberg over here to my left, obviously, with early childhood, and many others in the room. I mean, if you go, there's a database called volunteertime.org. It's for any 501c3. There are great organizations doing excellent work. Also on our website, if you go to the resources section and click on mobilization plans, you can see a lot of organizations who are doing excellent work in these areas. So I think most important is if you can figure out where your passion is, and what you want to do to drive change, and how do you find an organization, how do you find the strategy that you want to invest in with your time, with your resources, how do you mentor individually, how do you tutor individually. So how do we more collectively know that as a community we've got to focus on stabilizing families for the greater good for all of us. And so I would suggest that certainly there are a lot of great partners that we're coordinating with, and many others who are also doing good work. And did you want to respond to this one? Okay, different one. So, and also give us a call. Happy to get you connected in places where you have great passions. Yes.
Low-income housing developments can successfully provide the neighborhoods or communities that deal simultaneously with many of the bubbles on your slide. Could you tell us what's going on in Madison in that regard?
Yes. Thanks, Dick. So, Carmen Porco, I saw you. There you go. So if you talk about specifically, again, coordinating around neighborhoods and housing. So there are a lot of places in Dane County where you have services who are stacked and wrapped around families. So Joining Forces for Families, for example, which we've partnered with for many years. If you look at Northport, Packers Apartments. So how do you provide services in a continuum in places where you meet people where they're at, right, in their communities, in their housing? When you look at, for example, some of you probably saw the news that at Truex over on the west side, east side by the airport, we're rehabbing some of the apartments that are vacated, that are owned by the city, and we're working with nonprofit partners to help provide case management to get families more stable. And in the community, there's also a community center. So as you have families who are grappling with the realities of lower incomes and aspirations of more stability and great work ethic and great family values to be able to build self-resiliency and self-reliance, how do you help provide access in a more coordinated way? So that's really what we're talking about. One of the strategies is thinking about a hub model. So if you're working with physicians, for example, we've got about 6,000 babies born per year in Dane County. About 500 of them are born into poverty. So can you, in the delivery room, get folks mapped up to resources? And how do you help pediatricians and family practice docs get connected into resources and other social service providers to help provide that continuum? So not exactly housing related, but again, the same perspective of having a hub model to more holistically surround a family and get them stable. So does that answer the question? It's really important. So again, the fragmentation, you might have one family who has many different caseworkers or case managers. You've got school, you've got health, you've got social service providers. And so to coordinate that so you have more of a clear plan in terms of how does my family want to get stable, what resources do I need, and how do I do that? That's a really important way to help address, and it's very effective. We know that we have research-based and evidence-based practice that those will, in fact, get families stable. And one more question. Hi, Juan. Thanks, Dick.
Renee, first of all, I want to say thank you for putting this together and congratulations on being selected
Thank you.
as the new CEO. You look different than Leslie Howard. The question I have is, again, I know, I've been here for many, many years, but the housing situation, there's no such thing as affordable housing in Madison or Dane County. And then we don't want to address it as low-income housing because then that turns people off. Whether I'm poor or whether I'm middle class or upper class, I'm not going to change my, where I live so I can have affordable housing, whatever that is. But that definitely affects the segregation and the classism that exists in Madison, Wisconsin. And yes, there's poverty, and yes, there's racism. I'm not going to ignore that. But the classism is very entrenched in this community. I love Madison. I'm from Texas originally, but I love Madison and probably die here one day. But, that issue is a big issue. Centro Hispano and other Latino organizations are, we have a lot of talent, as Tanya mentioned to you. Of course, we have Maida that's here and, Karen back here. But that's an issue. And, is United Way going to take a bigger issue on the housing issue with the mayor and the county exec and on, and the developers? Because that's a tough one. And again, there's no such thing as affordable housing. So what leadership are you going to take, and United Way and your board going to take on that issue, which affects the racial disparity, affects the academic achievement disparity, affects the wage disparity that we have in this community? I make good money, so I'm not poor, but I know a lot of Latinos and African Americans, other people of color, that have not made it or have not broken that nut yet.
No, I love that question. I really appreciate that question. And just to underscore how important housing is to stability and helping people get on the path. Traditionally, shelters have been how we have supported poor families, right? But we know how bad shelter is for families, particularly families with children, for lots of reasons. Education outcomes are worse, health outcomes are worse, and it's just really difficult in terms of fracturing family when the person at the shelter is in charge versus mom or dad. So housing has been a priority of ours for a very long time, and Housing First, in partnership with the Road Home, YWCA, Salvation Army, many others, Porchlight, I saw Stephen here, and lots of other partners. It's an important thing in terms of grounding and stability. So let me just underscore that and say absolutely right. We are very eager. So the Basic Needs Team is the volunteer group working on affordable housing and homelessness reduction in Dane County. And, these are all very early thoughts. But we've had a lot of discussions about building affordable housing inventory, and I've talked to some developers and said, hey, why don't you guys build affordable housing? And, and the question is, well, in terms of incentives for building or what you were talking about, right, I don't want that in my neighborhood, all those conversations go in there. So I think that there is, an horizon kind of conversation, and certainly we talk with the mayor and county exec all the time about these issues, and we're in great collaboration with the city and the county to talk about available housing inventory. And so if you look at, is there a way to structure where you could have neighborhoods who understand that people in poverty aren't going to come in and ruin your neighborhood, right? And so people in poverty are working really hard. They want a chance to. So I think that's a really important educational piece that needs to happen. Building on those assets and understanding it's not someone's choice or not bad decisions that potentially gets them, in that circumstance. And then how do we work on building more affordable housing and working with landlords who have apartments who are available to be able to then come into the inventory of how we can help stabilize families. And one of the biggest ahas in terms of case management has been if you can get a landlord who says, you know what, this person doesn't have any credit history, Maybe they have an eviction on their record. Why would I rent to this person? You can say, well, a case manager is there to help them work through the systems. If there's a problem in terms of paying rent or looking at other kinds of issues that create instability, the case manager and the nonprofit will support them. So the business owner, the landlord, has more comfort being able to help that family be more sustainable and be more stable. So again, that's what I mean when it takes way more than one organization, one entity, but in collaboration with the city, the county, nonprofits, donors, volunteers, that's when we can create a path to create more affordable housing, build that stability, and help more people get on pathways out of poverty. So those are the strong roots I think we all need. So thanks so much. I know there are such great partners and advocates in the room. Grateful to be here today. Thanks.